Good morning. Thank you, Dr. James, for a kind introduction. Thank you for joining us for today's webinar. My name is Samantha. I'm a physiotherapist from National Heart Center. And I would like to share with you about exercising for better heart health. Here is the content of my sharing. Cardiovascular disease is the leading cause of death, globally taking about 17.9 million lives each year, representing 32% of global deaths. In Singapore, about 23 people die from cardiovascular disease every day. Cardiovascular disease accounted for 30.9% of all deaths in 2023. This means that almost 1 out of 3 deaths in Singapore is due to heart disease and stroke. For cardiovascular risk factors, about 1 in 3 adults aged 40 and above are estimated to have hypertension, 9% are estimated to have diabetes, and about 50% of the population has sedentary lifestyle, with many adults not meeting the recommended levels of physical activity. All these are major risk factors for heart disease, contributing significantly to cardiovascular risk. These statistics highlight the urgent needs for Singaporeans to be more mindful of living a healthy lifestyle, be more active in order to reverse the cardiovascular risk factors. That's the main reason why we are here today, to find out how to exercise for better heart health. Now I would like to share about how exercise will benefit your heart. When you exercise for a period of time, your heart muscle will become stronger. Your heart can pump more efficiently. This will lead to lower heart rate at rest and during exertion, which means the workload of the heart is lower. Exercise regularly can help your blood vessels to relax and widen. Also encourages the creation of new blood vessels. This means that there are more pathways for blood to carry oxygen to be delivered throughout your body. Secondly, exercise regularly will help your cells to make more mitochondria, which is the energy-producing unit that will help your body to use oxygen more effectively. Last but not least, exercise regularly will help your body to fight inflammation and your body to work better together, supporting your heart and overall health. How about exercise and hypertension? Regular exercise, aerobic exercise will result in a blood pressure reduction of 5 to 7 units among individuals with hypertension, and this reduction will translate to 7 to 14% reduced risk of stroke and heart disease. The blood pressure lowering effect of exercise can last up to 24 hours after activity. Most studies show that benefits are seen with at least 6 months of training. For exercise and diabetes, studies show that structured aerobic exercise reduces your HbA1c, which is a blood test that reflects your average blood glucose level over the past 3 months, for about 0.67% in patients with diabetes. The reduction in HbA1c level is associated with a decreased risk of cardiovascular events and also microvascular complications. So regular physical exercise over time can assist in effective blood sugar control and reduce the risk of diabetic complication. How much exercise should you do in order to gain the benefit? You need to exercise for at least 150 minutes per week with moderate effort in order to get a 0.67% drop in your HbA1c. In absolute number, a 1% reduction in HbA1c value is associated with a reduction of 40% of the risk of microvascular complication. Intensive blood sugar control can even lower the risk of dying from heart attack and stroke up to 57%. Okay, now we'll share about the exercise component and guidelines. There are 3 components of exercise: warm-up, conditioning phase, and cool-down. 5 to 10 minutes of warm-up will allow your heart rate and blood pressure to rise gradually, allow the muscle and joint to gradually adapt to increasing load. This will help to reduce the risk of injury. You can either walk slowly or do stretching as warm-up. Cool-down refers to the low-intensity exercise done for another 5 to 10 minutes. Cool-down helps the venous return and blood flow back to the heart, preventing your blood pressure from dropping excessively after exercise. Stretching the muscles and joints can also help to relieve the soreness you feel during exercise. Now I would like to talk about FITT, which is the exercise principle for aerobic training. F stands for frequency, which means how many times per week of exercise per week. I stand for intensity, which means how hard you should exercise. T stands for time, which means the duration of exercise. And lastly, T type or mode of exercise, we can either perform aerobic training like walking, cycling, or swimming to improve the endurance of your heart. And we can also do strength training where you can use dumbbells, TheraBand, or weight stations to improve your muscle strength. Here's an example of a weekly exercise routine you can do to build up your heart health. First, you can start with warm up, followed by at least 30 minutes of aerobic training. You can either go to the gym to use a treadmill or bicycle, or you can go to the park for a walk or cycling. For strength training, you can do alternate days of weight training, can do up to 3 times per week, either work out in a gym or use their free weights or weight machine, or you can also consider using the fitness corner equipment at the house, downstairs, and then end your exercise with cool down. Okay, here is the intensity guide adapted from Health Hub for healthy population during aerobic training. For those with heart disease, should not use this method. There are 3 levels of intensity. Maximum heart rate means you take 220 minus your age. That will be your maximum heart rate. Light intensity, which means your heart rate range target can be between 57 to 63% of your maximum heart rate. How you gauge the intensity is when you are able to talk and sing during exercise based on the talk test. Moderate intensity will be 64 to 75% of your maximum heart rate, where you are able to talk but not sing during exercise. Vigorous intensity will be 76 to 95% of your maximum heart rate, where you will not be able to talk or sing during exercise. Okay, for the heart rate calculation, if the individual is 50 years old, based on the formula I shared from the previous slide, light intensity heart rate will be between 85 to 107 beats per minute. Moderate intensity will be between 108 to 128 beats per minute. And vigorous intensity heart rate will be between 129 to 162 beats per minute. You can monitor your heart rate with the heart rate monitor based on the talk test. For someone who are new to exercise, you can always start with a light intensity. After you have conditioned yourself, you may progress to moderate intensity or higher heart rate in your training. But always remember, you need to listen to your body and know your limit. Ultimately, you just want to exercise to gain the benefit. Exercise with moderate intensity and do it regularly. That will be the safest method. You don't want to get any injury or complication from overtraining or overexertion. Okay, so for strength training, we will always target the major muscles during the training because those are the muscles that will help you with your daily function. We will usually do strength training for 2 to 3 times per week. For safety, remember not to hold your breath while you are lifting the weights. We need to breathe out or exhale during the weightlifting to prevent any injuries or complication. For the technique, try to lift slowly through the whole angle and lower your weight slowly, about 2 to 3 seconds to lift. For progression, you can start with 8 repetitions, then progress gradually to 15 repetitions. You can either progress your load, the weight of the dumbbells or the weight of the machine, and then progress, or you can also progress a set of the exercise, like 1 set of 10 become 2 to 3 sets of 10 repetitions. If you are interested to use the fitness corner equipment, here are some suggestions for you in using the equipment. Here's the aerobic exercise machine like bicycle, elliptical, or walker. You can do that about 5 to 10 minutes, then gradually progress your duration. You can do this daily or alternate day. For the weight training machine, you can start with 10 repetitions, gradually progress to 12 or 15 repetitions. Subsequently, you can do 1 set of 10, gradually progress to 2 or 3 sets of 10. Remember, you should do weight training for only 2 to 3 times per week only. Now I will share about the safety consideration for exercise. For those who have known coronary artery disease or 40 years old above who has been inactive all this while, you should seek for medical advice or clearance before starting a regular exercise program. Here is a health screening, the self-screening questionnaire that you can also use to help you determine whether you need to seek for medical clearance before you do this routine exercise. You can talk to the doctor about this questionnaire, like which question you answered yes in order to seek further investigation if required. How to reduce the risk of injury or exercise complication. You need to make sure you exercise in a safe environment. Always remember to wear proper exercise attire, use proper exercise equipment. Besides, you need to exercise regularly, like 3 to 5 days per week if possible, so that you are more conditioned to exercise. Always remember to do your warm-up and cool down. This will help to prevent injury. Exercise with moderate effort, not to overexert yourself. Must know your limit, work within your ability. Then gradually increase the volume and the intensity as tolerated. Seek for supervision if required. Do not exercise if you are unwell, like having flu or diarrhea or any sign of infection or on antibiotics. If you experience chest pain, pain in the jaw, neck, back, or arm, or you suspect heart attack symptom, please seek medical help immediately. If it's emergency, call ambulance 995. In order to continue a lifelong or habitual exercise, you need to choose exercises that you enjoy, and preferably you will have family or friends to do that together. Always set aside time in your schedule to exercise so that you can do that regularly. If you experience any health issues, please seek medical help. Here's the summary. That's the end of my sharing.